Welcome to the Parent's Guide to Children's Orthopedics. In this video channel, we'll try to explain common orthopedic conditions in children. Also, try to answer the commonly asked questions by parents. Please subscribe to our channel so that you receive our regular updates. I'm Sattar Alshryda. I'm a pediatric orthopedic surgeon, and in this video we'll go through what we call the normal variants in children. This includes flat feet in children, in which there is no arches in the foot, to in-toeing, in which the child walks with both feet pointing inward, and the last is both legs and knocked knees, in which the lower limbs curved either outward or inward, as we see in these pictures. And this video will focus on a flat feet, in which the foot arches are not visible on standing. Flat foot is a clinical sign and not a disease name. It can be physiological or normal, or it can be pathological. Children are born with a flat feet. 50% of the children, the arches are visible around the age of 8. 90% the arches are visible around 16, and 10% of children the arches are not visible even when they become adult. This doesn't mean they are not normal. There are several reasons why do children have flat feet. The first reason is that most tarsal bones are still cartilaginous. By tarsal bones, I refer to the small bones of the foot, and we explain this further down the video. The second reason is that young children have intrinsic laxity of ligaments and tissues. They are more flexible. The third reason, muscle strength in children is still developing, so the muscles are not as strong as they are in adult. And the fourth reason is that young children possess a fat pad underneath the medial aspect of the foot, and when they stand, this bulge out. Now let's look at these two x-rays. On the left hand side is a newborn child x-ray, and on the right side is the adult foot x-ray. In the left side you can see this area which I am marking by the red arrow as if there is no bone there, compared to the adult side where it fills of bone. Normally there are 7 bones in the middle and the back of the foot, and in adult they are made of bone. In children they are still made of cartilage. However, at the center of each cartilage there will be small ossification center appear, and it expands to the adult size. Until then, when the child stands on their feet, because of the bone still made of cartilage and is flexible, the arch will become flattened by the weight of the child. And this is the reason why children have flat feet when they start walking. And we call these flat feet the developmental flat feet, because it's part of the normal development of children's feet. Around 50% of the children, the arches become visible around the age of 8, and 90% of the children, their arches visible around the age of 16. Still, around 10%, depends where you live, of the children, they never develop arches in their feet. However, these feet are still normal and behave and function normally unless they have one of the 3 red flag signs. The 3 red flag signs including pain. Developmental flat feet are not usually painful, and if they are, we must look for the source of the pain. Second, developmental flat feet are not rigid, are usually flexible. And the third, if they are severe. Let's talk about the rigidity of the flat foot, or the flexibility of the flat foot. When you look at the feet from behind, the heel usually inclined to the outside, as we can see with this green arrow. This is when the child stands. But as they stand on their toes, both heels move inward and the arch becomes visible, as we can see in these green and red arrows. And we call this a flexible flat feet. Now let's look at this video of a child who is standing on her feet. Both heels are inclined outward and the arch is not visible. Now she stands on her toes. As she stands on her toes, you can see both heels move inward and the arch becomes visible. And this is what a flexible flat feet are. And we expect the developmental flat feet in children to be flexible like this. Contrary to this child who had rigid flat foot, particularly look at the left side, as the child stands, the heel remain outward and the arch remain flat. And this is called rigid flat foot, which is abnormal. And the last red flag sign, which is the severe flat foot. By severity, we mean that when the child stands, the lateral border of the foot remain touching the floor, as you can see in the green arrow here, pointing to the lateral border of the foot, which is touching the floor. If the flat foot is severe, usually the lateral border of the foot is lifted off the floor, as you can see in this chart, where the lateral border of the foot is completely off the floor, as indicated by the red arrow. And this one is another red flag sign, needs certain attention. Just to recap, flat feet are clinical signs and not diseases. All children are born with what we call a developmental flat feet, and usually when they start walking, we see flat feet. These usually common, they have no symptoms and flexible, and they don't need any treatment. Of course, there are a very small group which are pathological flat feet. These are extremely uncommon. They often have symptoms, and the feet are usually rigid. And I've already explained what rigid means. They often require treatment, and here I listed some examples of pathological flat feet. And we cover some of these pathological flat feet in various videos in the channel. And finally, we urge parents and physicians to avoid treating flexible flat feet with insoles, as the evidence shows that these insoles have no long-term effect on the shape of the foot. Also, they have detrimental psychosocial effect on these children when they grow older. Needless to talk about the cause of these insoles. One interesting study compared the children who walk barefooted most of the time versus those who wear slippers, those who wear sandals, and those who wear shoes. They found 2% only of the children who walk barefooted remain flat-footed, while this increasingly more in children who wear slippers, sandals, or shoes. In another word, the more you support the foot, the more you delay the development of the arch. That's why we don't recommend treating normal developmental flexible flat feet. I hope you find this video useful. Please watch our videos about flat feet, particularly the one about acquired adolescent flat feet, which is a preventable and treatable condition.